Transferring patient from bed to wheelchair. Many patients have conditions that impair their activity or result in immobilization. Transferring these patients without injuring them or yourself is an important nursing responsibility. Whenever required, you can ask assistance of another nurse in transferring immobile patient. Begin by providing privacy. Perform hand washing and put on gloves if indicated. Introduce yourself to the patient and identify the patient using at least 2 identifiers, that is, complete name and date of birth. Place the wheelchair at 45-degree angle to the patient's bed, towards the patient's stronger side of the body. It should be midway from head of the bed to foot and engage the brakes of wheelchair. Lock the bed wheels and adjust the bed to lowermost position. Keep the head of bed at 30 degrees. Assist the patient to side of the bed and turn the patient towards you. Stand next to her body and create a wide base of support by keeping your feet apart, making a Y by placing the foot near to the head side of the bed, slightly ahead and turned. Now place one arm under patient's shoulder and another arm under popliteal fossa. Move her legs and feet over the side of bed. At the same time, lift patient's upper body and make her achieve sitting position. In this, you bend your knees, avoiding bending your back and shifting your weight from front foot to back while helping patient to sit. Remain in front of patient until she regains stability. If possible, her arms can be placed onto her sides to help her get some support. Now, help the patient to move toward the end of mattress and provide socks or anti-slip shoes. Let patient be in this position for some time. Do not leave patient unattended at this point. Assess if she can maintain this position. If patient feels dizzy or is uncomfortable in sitting position, stop the procedure and try to shift her later. Now put a gait belt around patient's waist over the gown or place your hands under axilla of the patient to support her body properly. Spread your feet and flex your hips and knees. Keep your knees just next to those of patient. On count of 3, rock her up to standing position by straightening your hips and knees. Move your body weight along with that of patient. Support the patient's weak side with your body. Slide toward the chair by moving your legs opposite to patient's leg near to wheelchair. Ask patient to reach for armrest of wheelchair and slowly lower your body by flexing your hips and knees. Make sure that the patient is sitting well back in the wheelchair. Make her comfortable. Place her feet on footrest of wheelchair. Keep the call bell near her. Monitor patient's response to the procedure and if required, assess her vitals. Allow patient to sit for 15 minutes at first and then you can increase the duration depending upon her response. Perform hand washing and document duration in wheelchair and her response to the procedure.